Hello there, it's time for the first quarter financial results and business update from Volition RX. Joining me is CEO Cameron Reynolds. Of course, Cameron, this is happening at a time of COVID-19, so inevitably the first question is, what effect is this having on Volition?
We have worked very hard at Volition to make sure we're as productive as possible during this COVID pandemic. We've been very responsible to our team members and socially distanced, and those who could work from home have. But I'm also very excited to say we've kept the lab and facility operational in Belgium, so we've managed to meet all of our milestones as discussed last call, and the team has worked exceptionally hard to make sure that they're as productive as possible during this difficult time.
And I understand that Volition is in the process of developing a test to help during the COVID-19 pandemic. You have some data that's published today, so tell us a bit more about this actual test.
With the data really hot off the press this week, we can now see that we can very strongly discriminate between people who are COVID positive and normal controls with an AUC of just under 99%, with 100% detection at 94% specificity. So that's a very good start. We're just working now with our clinical collaborators to work out what's the clinical question we can best answer, what's the clinical utility. There's a lot of potential different things we could help with, diagnostic, triage, prognostic, all those things. They're collecting samples now. We expect to have more data very soon in a range of different areas with our two major collaborators. So if we can find some good clinical utility, and it's encouraging to start the data we have, it's definitely something going on, it could move quickly.
So that's the latest on this potential test during COVID-19, but also during the pandemic, it strikes me that Volition has been very busy hitting some of the normal milestones that you would be aiming for at this time for the business.
Yes, we've done a huge amount of work during this quiet pandemic period where we've been working from home and from keeping the laboratory going through distancing. And I'm extremely excited to be able to say we've kept our milestones. We now have 8 assays on the platform ready for the big trials, which was exactly our target and an aggressive target. We've also worked with Volition in China to start the work there on adapting it to the Lumiart platform. We've also done a lot of work on capture. We've done a lot of work on VET and, of course, COVID, as I previously said. And it sets us up very strongly for a very large amount of milestones and activity in the second half of this year and next quarter.
Okay, let's drill down into a bit more detail about Nu.Q Vet. There has been a very interesting video recently from Heather Wilson-Robles. She's the Chief Medical Officer for Volition Vet and also works with Texas A&M University. And here we're talking about some more data and possibly a product available later in the year.
The vet data has really shown the utility of our platform beyond all the other things we're doing. It's something which has been run in the Texas A&M Vet Hospital, which we've been shipping our kits and now our platform to them. This is really something we've been working for a while now. The ability to ship kits around the world and our platform and let others who have really good knowledge in their space to run our platform and get results. So to see really good discrimination in 2 very important dog cancers, AUCs in the 80s with very good discrimination. It's just really exciting. And we're going to see a lot more data coming from Texas A&M now. We're very comfortable to move forward with a lot more assays and now moving to our automated platform. And we also aim to do capture and sequencing and mass spec work on the vet samples as well. And we also aim, as Heather mentioned in her video, to launch the first product at Texas A&M this year in the vet space, given these very exciting results.
Let's move across the globe now over to China, and there you have been working very closely with the Fosun organisation.
We've been working very hard to get the assays developed so they can be shipped around the world and licensed to different groups. So we're working with Fosun in China, a very good organisation, to adapt our assays to their platform. It's called the Lumiart. Now that it's on magnetic beads as well as plates, they have their own magnetic bead platform. We're working with them to adapt to the platform. And if that all goes well, we'll start licensing discussions with them to license our assays for the Chinese market. Again, very exciting. And it's something we can provide the intellectual property, the knowledge, and also the antibodies and controls now that we do everything in-house.
You've also got an exciting time ahead because on the horizon is the world's largest oncology meeting. It's going to be a virtual conference for obvious reasons, and Volition is submitting abstracts for this conference. I know you can't say too much specifically about those, but tell us what you can say.
Part of us being very confident now that we have a very robust, reproducible platform, and also being extremely confident with our intellectual property, we are now aggressively publishing our data and our platform in a range of different forums. ASCO is one of the world's biggest cancer conferences and the biggest in the US. So we have 3 abstracts accepted there, which become public next week. We obviously can't talk about them until they're public, but look out for that. We're very excited. And we're also working on a number of peer-reviewed publications of our platform, of our data, and how our Nu.Q platform works in a range of different uses. So this is the start. Next week, 3 being accepted, and expect to see a lot more this year.
Even at the time of a worldwide pandemic, financials never really stop, do they? So Cameron, can you update us on Volition's latest financial news?
We have done a huge amount of work with our current budget, and we remain within our budgets to really perform all of our milestones. We finished the quarter with $12 million in cash, and we continue to use it extremely wisely to continue with all of our milestones going forward.
So interesting and challenging times for Volition and the rest of the world at the moment. Let's finish, as always, with a conclusion. Let's look at that road ahead and tell us, Cameron, what we can see on the horizon.
We can expect to see a lot of activity this quarter and throughout the rest of the year in all of our key areas. Expect to see some more COVID data and to see the clinical utility of our encouraging data, extremely encouraging first pass at the preliminary data we've just released today. Also, you'll see a lot more data on the capture side, which we're very excited about. Further progress and updates on the veterinary side and the work we're doing with Texas A&M in a range of different cancers, in a range of different assays on platforms, and then hopefully the first product. We'll also see a lot more data from our finalized product platform on the magnetic beads in lung, colorectal, and the blood work, our marquee colorectal programs, as well as the others. That's going to really pick up through the year as well. And also, there's a lot of other information we'll be having from licensing, as we talked about FOSM, as well as other potential areas where we work through. We're filing a lot of new intellectual property. We're talking to new collaborators, and we're really picking up in every key area.
Okay, Cameron, a lot going on for Volition at the moment, and we will be very much following your progress in the future. Thanks very much for joining us today.
Thank you very much, Nick.
And smile.